Welcome to another edition of RealiTV. I'm your hardworking disabled American host. A lot has been going on lately if you've been following our webisodes. The good news is MassHealth has finally approved me to fit in with the rest of the illegal aliens, irresponsible mothers, dead people, and terrorists that obtain such benefits. We included some DVDs which might have helped the process along. I do not know that as fact. Also received a giant package from Social Security Disability. It took me about 45 minutes to fill that out. That is, we're going to keep that an exclusive webisode where it is so long. But fall is in the air. We have a lot going on behind the scenes here at RealiTV. So what we're going to do now is combine some of the webisodes we've already taped and give you the knowledge you need to know and share with your friends. Until we speak again, be well, spread the word, and let the good guys win. Welcome to webisode number 9 of RealiTV. I'm your hardworking disabled American host. It is Thursday, August the 1st, 2013. Where is the year going? It's unbelievable. July is already gone. Summer's half over, probably a little bit more than half over, considering some consider Memorial Day the kickoff to the summer. But you know what? We've been talking about CRPS, complex regional pain syndrome. CRPS, yeah, I got it right this time. It's a difficult one to remember sometime. But you know what? Let's talk summer. I'm in the vacation mood. I've got the blue shirt on. I'm in Hawaii. I'm in Florida. I'm not battling the state and insurance companies and hospitals and everything else to try and live like a human being. But I decided where I have requested so much from the state, which usually disabled folks are entitled to. I have a few promises I would like to make. Unlike politicians, these promises are those I intend to keep. All right, let's see. I promise, if given Social Security Disability insurance so I can actually have some financial income, that I will not abuse the Social Security Disability income, meaning once I am able-bodied again and return to work, I will not use it anymore. I don't want a lifetime pass. I just need some income, to live a little bit. The next one, I promise I will not abuse any form of state-provided health insurance, meaning once I'm healthy again and return to the workforce, I'm not going to abuse the system, as you see over and over and over again in print media, televised media, and so on and so forth. I need it right now, but once I'm able-bodied, like I did until I was injured, and even while I was injured, I hadn't paid for my own health insurance through work. What else do we have now? With everything that's been in the news lately, I think it is important to say, if I had a Bible, I'd put my hand on it. But where you see those that somehow manage to get these benefits and the hardworking disabled Americans that don't, if I had a Bible, I'd put my hand on it and swear that I am not an illegal alien. I am not an irresponsible mother that has had a plethora of children, sometimes with a plethora of different fathers, that continue to abuse the system, with not even a slap on the wrist. I swear, since this was a point of contention back in April, I swear I'm not a terrorist. I have no intentions on blowing anything up or killing people. I know they have received benefits from the state of Massachusetts. I would like those as well. With the expose that came out a few months back, with some dead people that were receiving health benefits, I swear on a Bible I am alive. I may not look it sometimes, and I may not feel it sometimes, but I promise I am alive. Where I had to, sadly, in the sense of desperation, where I do need to eat, even though I have a little insulation around the midsection, with what has gone on with another murderer in the news, I promise, if given food stamps, I won't sell my EBT card. It would be nice to eat, but, I could be homeless too, so it could be worse. So there you have it for the state of Massachusetts. I promise I'm alive. I'm not a terrorist. I won't sell an EBT card. I'm not an illegal alien. I was born right here in the USA at Melrose Wakefield Hospital back on September the 21st. I am not an irresponsible mother. It would be difficult for me to give birth, but that's a different story for a different time. So as we continue to try and provide you as much meaningful information as possible, it is the summertime. I know things slow down even more so, even though it's been a 19-month process at this point. I look forward to communicating with the state to see how these benefits can be obtained by being a hard-working disabled American and not an illegal alien, irresponsible mother, a terrorist, dead, or an EBT card hustler. I appreciate your time once again here on RealiTV. Join us on our social media platforms. Email us. We want to hear your stories about the shenanigans that have gone on in your lives. And until we speak again, as always, folks, be well. Welcome to the Wednesday, August 7th, 2013 edition of RealiTV. I'm your hardworking disabled American host. Very interesting week. We got a lot to talk about. Lots of good stuff coming in the mail, email, so on and so forth. But the one that I couldn't resist was the letter from Melrose Wakefield Hospital sent certified. They spent $5.60 to have this sent to the studio and certified. I'm very impressed by that. I'll read the letter itself. This is from Stephen P. Spardella, the medical director of quality at Melrose Wakefield Hospital. It states, "Dear hardworking disabled American, our public relations department is in receipt of your letter and DVD. We have completed a thorough review of the medical care and follow-up plans provided to you. This review concluded that your care was appropriate for your emergency department presentation. On behalf of Hallmark Health System, we remain hopeful that your chronic health condition improves." Now let's take this at face value. Let's say they really believe that this care that I've received was appropriate. I've been there 5 or 6 times since 2008 when my physical issues went overboard. 2 times within 3 days initially in May of 2008. Now when someone can't walk, when they come in to your emergency room system with a destroyed orthopedic boot, you send them out in a sock. I don't know if that's appropriate. If they're back in the ER less than 48 hours later with the same problem in a different leg and a different foot, you send them home in a sock. I don't know if that's appropriate. If people legitimately need a wheelchair, I'm not talking about the laws that state they have to exit in a wheelchair, physically needing a wheelchair to get to their automobile to go home, maybe they need a little bit more care than what you find appropriate. Maybe the quality needs to increase. Just last night we were talking about a medical condition of someone down here at the studio, Melrose resident, and they said they wouldn't take their pet to Melrose Wakefield Hospital. That is a true story. I'm not trying to get a little dig in. I do respect the fact that Melrose Wakefield Hospital responded to me. But when someone continues to come in with the same issues over and over again, and then you go to a hospital like Mass General that as soon as I came in, they admitted me to try and help the situation they were dealt. I just don't understand why the quality of care at Melrose Wakefield Hospital is so low compared to the quality of care given to you, such at Mass General Hospital, which is so high. I don't know. We've asked a lot of people. Again, I do respect the fact that they actually had the spine, no pun intended to mine, that needs a spinal fusion, to actually respond to us here, but that's a pretty good question. If you are in the vicinity of Melrose Wakefield Hospital, if you know you have some kind of an issue or appointments coming up, is the quality of care that they find appropriate at Hallmark Health and make Melrose Wakefield Hospital on par with other hospitals in the area? That is for you to find out. If you've had experiences, good or bad, at Melrose Wakefield Hospital or any other provider that might be helpful to the folks that watch this program, hey, there's plenty of ways to find us on this page. We've got Facebooks, Twitters, email. Let us know. Like I said, we have a lot more stuff to talk about this week, some actually good news. I want to fill out a form for people on this webisode program so you can see what it's like to actually go through it. If you unfortunately find yourself in my position or are in my position, I hope you're not. But until we speak again, it has been my pleasure. More questions than answers, but we're getting somewhere. Be well. friends from around the corner, around the world, welcome to another edition of RealiTV as we continue to tell the story of this hardworking disabled American, and hopefully a story that resonates with folks in similar situations, how we get treated like dirt, pounded into nothing, as the benefits continue to roll along for irresponsible mothers that continue to have child after child to obtain more benefits, the illegal aliens that come into the country, obviously illegally, that continue to get benefits, terrorists, as we know from the bombing back in April here in Boston, the unfortunate incident that took place, they were obtaining benefits. We've had individuals going to jail for murder and other crimes, trying to get sex changes that the taxpayers pay for. And here in the great old state of Massachusetts, we have dead people trying to obtain these benefits. So as this nonsense continues, this despicable way to treat hardworking Americans, we continue to tell the story. Here I have this giant packet that was sent to me. It seems like it's some kind of a progress, which is a good thing. And I have to fill this out to see if I am entitled to be a disabled American. As I've noted, I received paperwork from my doctor and, from my doctor as far as receiving a disability placard for an automobile, disability MBTA pass. If you're out of Massachusetts, that's the public transportation system. I'm working to get Mass Health, as I can't even see a doctor right now, even with the plethora of issues with my neck, back, and feet. But what I'm going to do is to try and show you what exactly you have to go through if you are an unfortunate disabled American to try and get benefits that you've paid taxes years and years and years and years into. I'm going to fill it out on this very program. I don't know how long it's going to take, but we are going to do so. This is going to be mailed to London, Kentucky, to a lovely lady named Eunice Newton. All right, let's see. These are just some basic instructions. We're going to make a DVD of this and include it to Miss Newton, because we like folks to see what we're doing here on RealiTV. We got quite the response from Melrose Wakefield Hospital as far as them feeling they did a appropriate job in my visits to the emergency room there, which questions what they consider to be quality and what they consider to be appropriate. Let's see. Well, a lot of notes. All right, my daytime telephone number. I don't think anyone needs this, so I'll just fill that out. I have my trusty assistant, Nico, who's been an MVP here all summer long, especially. We're going to give him a hell of a letter of recommendation if he decides to go on to college once he leaves high school. I guess who do I live with? Emily. Describe what you do from the time you wake up until going to bed. I could really have some fun with that one, but let's see. I wake up in severe pain. I take several medications, struggling to stay awake. I struggle to get to the bathroom. And groom. What else do I do every day? I volunteer or lay in bed flat. I battle extreme depression and suicidal thoughts. I miss the kids in my life because of this disability. I think that's from the heart. Okay, do you take care of anyone else, such as, well, I'll say yes, I take care of my ex's children, financially. No, I do not take care of pets. Does anyone help you care for other people or pets? I do have a little dog. What were you able to do before your illness, injuries, or conditions that you can't do now? And they gave me, literally, it's this one right here. I don't know if you can see it, but it's a line and a half. I could write a book and a half about the things that I can't do now that I could do before everything happened. But let me, let me do my best to explain. Let's see, what was it? I could get out of bed, shave. That's a very difficult thing for me to do standing still. Bend, that's rather difficult. I dropped a rubber band a little while ago here at the studio, and I had a very difficult time picking the rubber band up. Let's see, bend, I wasn't depressed or suicidal. I was generally a cheerful person, depressed or suicidal. Let's see. I could walk without a cane. I could wear shoes instead of sandals. I could work. I had insurance. And many more. Do the illnesses, injuries, or conditions affect your sleep? Yes, they do, as a matter of fact. I have insomnia. As a result of post-concussion syndrome and post-traumatic stress disorder. Personal care. Explain how your illness, injuries, and conditions affect your ability to dress. Takes a long time, as my body can't bend. Bathe. Can't take a bath. I've always worried when I'd like to take an ice bath to soak myself. You know, I really don't want to be trapped in the bathtub yelling out the window for someone to break in and help me out of the tub and finding a naked, hard-working, disabled American in the bathtub. But luckily, we haven't got to that point yet. Care for hair. Well, I mean, you know, when you have a Newberry Street-looking hairdo like this, what more could you ask for? But no, that's a daunting task. Takes time due to balance. Shave, as I already mentioned, takes time due to balance. Feed self. Well, I can eat. Use of toilet. Well, it can be difficult. This is very personal. Difficult to stand as I urinate. I think Nico is going to leave the room. He's heard about enough. I mean, a lot. How about that? There's a lot that goes on in addition to the personal care section. Do you need special reminders to take care of personal needs and grooming? Yes. Post-it notes. All right, is this it? I don't need this one. I don't need this one. I don't need this one. Anything I'd like to add, I would like to get healthy and return to the work world and have my taxes support hardworking Americans that need help in life, not the irresponsible, not illegal aliens, not criminals, not terrorists, and not dead people. A video of this and others can be found at facebook.com/RealityAmerica. We want to make sure we get it right. I'll fill out my name and so on. Reality.America. Along with other videos of my nightmare. Please help. All right. Address. 02148. Well, as you can see, this takes quite a while to put together. They were kind enough, where I have no income, to send along an envelope that can be dropped in any mailbox. We're going to include a DVD of this so the folks, Miss Newton and maybe others from the Disability Determination Services Center, can see what goes on here. I think it's very important. Nonetheless, this took quite a while. Hopefully it'll be an interesting video. If you're in my situation, hopefully you'll get a little dose of what you're in for if you go down this path. Nonetheless, I'm a tired, disabled American sitting here under these lights with all the medications I take. My throat is very dry. It's almost as dry as the train that comes through the studio from time to time, but they've been very dry for a long time. That's a different story for a different time. For my good friend, my assistant, my intern, my non-blood brother Nico, until we speak again, be well. Welcome to the Wednesday, August 28th, 2013 edition of RealiTV. I'm your hard-working, disabled American host. Very tired man right now. I didn't even plan on being here today. I was thinking of actually taking the day off from the studio. We have a fundraiser coming up in September. I had to do some video work in New York City on the way home. The bus I traveled on broke down, and that led to a 3-hour delay, and another bus picking us up, and we arrived 4 hours later than planned upon in Boston, came home, and got about 5 hours sleep before I got ready to come here. But the reason why I came was because this was waiting for me in the mail. Open immediately. This package contains important information about your health benefits. And after 21 months of fighting the good fight, 21 months of anger, disappointment, frustration, depression, hatred, even laughing at it, it was so pathetic sometimes. This hard-working disabled American has been approved for Mass Health, the same health insurance given to irresponsible mothers that have child after child after child and reap benefits like there's some kind of a mileage benefit on a credit card. The same benefits that are given to illegal aliens, the same benefits that are given to terrorists, the same benefits that are given to dead people. I have it. Today we can say, even though the fight isn't over yet, there's still Social Security disability, There's still other life issues that need to be dealt with. But today, we can say the good guys won. Right defeated wrong. All the bullshit over 21 months of me living in complete and utter agony, especially since January 1st, when my doctor wasn't able to prescribe me certain medications anymore. We have won. Thanks to this program, sending these government agencies DVDs of what we're doing, not giving up, fighting the good fight. I think I already said that, but I'll say it again because I believe in it. The positive karma has come around, and hopefully it's going to continue. But I can say today that once I fill out this information about a doctor, I will be ready to roll, finally getting this back fixed, hopefully addressing the CRPS on some level in my feet, getting the medication that I need. It's a happening. I have to thank the great folks at this studio that help with this production, especially my aide Nico that's sitting behind the camera now. I have to thank my primary care doctor, who I will not drag into this insane set of videos that we've made, but he's a very good man that was the only, and I say only, advocate that truly cared about what was best for my health over the past 9 years. But the past 21 months have been grueling. When I went to the Boston Pain Care Center over and over again for them to hustle me with their little treatments, to whore out my regular insurance as much as they could, then they treated me like a dog in the street once there was no more insurance. Well, now I have something to work with. There's bullets in the gun because there's insurance for this hard-working disabled American. I am absolutely exhausted. I have no voice. I have no idea how I'm talking this loud to begin with, but we had to prove the point. We had to get the information out, and I want to help you. If you're in a situation like this, email, tweet, Facebook, get a hold of us. I want to help other people with what I went through. 21 months of this was absolutely ridiculous. It was insane, and it should be illegal in the United States for a human being to have to be treated this bad and live in the daily pain that I'm in. But you know what? For today at least, all that goes away. It was like that little Hawaiian vacation video I did a few weeks back. There's a lot less stress on me right now because I know things can get accomplished now. That's the moral of this video. That's the moral of this story. We're going to continue to fight the good fight in the other aspects of this disabled life, but we now know that insurance is part of the game and that inroads can be made, and I cannot be happier than that. After being stranded on Route 95 North for 4 hours waiting for a bus to come in the middle of the highway. Different story for a different time. Until we speak again, as always, be well, and let this story show that 21 months is a long, 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 long time, but in the end, good things can happen. I will speak with you soon, my friends.